So I'm going to talk about premature atrial contractions or PACs. So what they are, it's an irritable focus point in the atria, like in atrial flutter, but the difference is that this one doesn't go off all the time. It goes off spontaneously and irregularly as well. So it doesn't always go off. Usually we rely on the SA node, but this one actually interrupts the signal from the SA node. So the SA node will usually fire. This will interrupt it and be the next beat, so it will be a premature beat, just like in the name. Over time, this little focus point can actually lead to conditions such as atrial fibrillation and atrial flutter as well, especially those with already underlying cardiac diseases. So what causes PACs in healthy people? They can be brought on by alcohol, nicotine, anxiety, fear, infections, and even just being overly fatigued. People say that they feel like they've skipped a beat, or they'll complain of palpitations as well. So things to look out for in the ECG itself. So the PACs, because they're from the atrium, they're going to be looking like a P wave, but they're always going to be irregular, just like a weird morphology of a P wave. It doesn't look rounded or upright. Sometimes it's just a weird P wave, basically. Because they're premature, the regularity is going to be disrupted. So the underlying rhythm would be regular, but because we've had this premature contraction, it's going to make the rhythm irregular now. The P waves, so we will have normal P waves if it is a sinus rhythm. We can have other rhythms. Well, let's just say in this case we're going to have a sinus rhythm, so we'll have normal P waves, upright, rounded, but all the PACs are going to be irregular P waves. So we need to mention both. The PR interval in this case, it's going to be, it can be different. It can also be the same, but you just have to look at the P waves, I guess. But just be prepared that it might be an interruption to the PR interval duration. The QRS complex, it's going to usually be less than 0.12 seconds. And the PACs can actually precipitate QRS complexes as well, and that's what makes the rhythm irregular. They don't always have to cause a QRS complex either, but usually they do. Let's look at this ECG strip here. So first of all, let's look at the regularity. So we can already see that it's an irregular rhythm because the R-to-R intervals are all different. So next we'll look at the rate. So because it's irregular, we have to use our 6-second method. So we've got one tick here, here, and here. So let's count 1, 2, 3, 4, 5, 6, 7, 8. I'm going to not include this one just because it's on the border, so I'm going to say it's about 80 beats per minute. The next step, look at the P waves. So we can see here that some of them are upright and rounded and others have this weird kind of morphology going on here, and every time there's one that isn't upright and rounded, our rhythm is actually shortened. So this is what's making the rhythm irregular. So these here are actually our PACs making the rhythm irregular. So next we're going to look at the PR intervals. So they look pretty normal, but these ones here with the PACs look a little bit longer, or it just might be the shape making my eyes a bit funny. But we don't need to be too concerned about the PR interval here. QRS complex is normal, less than 0.12 seconds. So our interpretation here is this is an underlying sinus rhythm. So we say it's going to be a sinus rhythm at a rate of 80 with PACs.